Hi, I'm Dr. Ram. Today, I'm going to explain the myths about the hypertension. Again, many of us think that blood pressure, when it increases, it always produces symptoms like dizziness, giddiness, headache, and neck pain, all these. But majority of these problems are not because of hypertension. It is very unusual for hypertension to have reeling sensation, but sometimes, very rarely, it can produce dizziness. But even headache is very rare because of hypertension, unless there is a rupture of the blood vessel and producing brain hemorrhage. To that extent, if the hypertension goes, then it will produce headache. Otherwise, very unusual for hypertension to produce headache, very unusual to have neck pains, reeling sensation. Majority of the times, this is because of something else. So hypertension don't produce any symptoms, but you should treat it. Why should you treat hypertension when there is no symptoms? Because when the hypertension is not treated properly, it will actually degenerate the organs faster. For example, your lifespan is 70 years, suppose. If the hypertension, you got the hypertension at 40 years of age. If you don't treat your hypertension, then it will next 10 to 15 years of a hypertensive patient, if the BP is not controlled, there is always a chance of early renal failure and early heart attacks, even brain hemorrhage or strokes. So your lifespan will come down if you don't treat your hypertension. But at the same time, hypertension, majority of the times, it will not produce any symptoms. But you should have a periodic checkup when you have strong family history, when you cross 35 years of age. Always have a periodic checkup to check your BP. This is just like servicing to a vehicle. When your vehicle is spoiled, not spoiled, when it is working properly, you tend to take to the servicing station and get a proper servicing done. This is the same way you have to treat your body. So don't wait till the symptoms occur. So have a periodic checkup after 35 years, and whenever you detect hypertension, try to treat it properly and have a better lifespan. Otherwise, once you come to know that hypertension is producing some symptoms, then most of the times it will be an irreversible condition. You cannot treat the organs, whatever is damaged, permanently, and it will be both financial, psychological, it will have a lot of impact on your family, and it will be very disastrous to one's own life. And whenever a patient is having hypertension again, sometimes in 24 hours in a day, there will be variation in your blood pressure. So if there is one high blood pressure of 180, suppose, and one low blood pressure of 100, don't panic yourself. You have to take the average recording. Sometimes when you're panicking, your heart rate tend to go faster. In that kind of situations, just cool down, relax, recheck your BP after some time, recheck your BP with your nurse. If you are actually getting panic when you see the doctor, you can recheck your blood pressure with the nurse and see the average readings. So one high reading, one low reading, then don't worry. Your low reading is probably the right one. So don't worry about the fluctuations in blood pressure. So have your average reading. Whenever you have a blood pressure recording, try to be cool, just relax and have your BP checkup. And if the BP is still higher, then consider you are a hypertensive patient and start using medicine. Just if you check your BP in a hurry way, and once you have high recording, don't presume that you are a hypertensive patient. Just have an average recording and always try to check your BP in a cool, calm place and try to relax and check. And nowadays, in fact, many people will check the BP with home recording electronic manometers. Again, there tend to be variations. Sometimes it may show false positive reportings. There again, you will presume that your hypertension patient. Don't panic yourself. And even if the hypertension is recorded, blood pressure is recorded for you, don't panic. Just don't rush to doctor immediately. Just cool down, take your own time, visit the doctor, and take the necessary prescriptions. But your prescription should be actually thorough and it should be lifelong. Never discontinue that, because the hypertension don't produce any symptoms majority of the time. So you don't feel that if you don't have any symptoms, your body is fine. Even if the symptoms are absent, even if you are fine, always check your blood pressure and have a better lifespan. Detoxification, that's if you go thorough into that, Your blood is already pure blood. If the blood is impure, you tend to manifest many symptoms.